updating our website, updating our social media, Facebook, Twitter, but sometimes stuff gets lost in the shuffle for you as the resident. So hopefully I'm going to go through a couple things today, a couple core areas, just about 8 topics. Hopefully keep it to about half an hour and let you know kind of what things are happening in Livingston County as it relates to COVID-19, some updates on testing, and a few other topics that we're going to cover here this morning. So thank you for joining me. A couple of just public service announcement plug before I begin. I am wearing this mask. We are wearing the masks around here in the County Emergency Operations Center, but just everybody, this should be what you're wearing when you go about your runs to the grocery store and you're out and about and you cannot keep social distancing. So I'm not going to wear this for the presentation, but just as a reminder and a plug to wear your mask. So let me start with the subject of testing. That's a question we get often. How many tests are out there? Who's getting tested? Why are people getting tested? So just want to give you an update on testing. Right now we are working very hard to expand testing in Livingston County. We are very thankful and grateful for the partnership we have with Noise Health, WROC, who has been very supportive of the county's efforts in the public health department to expand testing beyond what has been provided to date. Right now we are at 635 people tested, which interestingly enough equates almost to exactly 1% of our population. So we want to get much, much higher than that, but that's kind of where we're at right now. We've had a spike in testing with some recent case developments of late, so we have, and Noise has expanded some testing. So right now we have a curbside testing availability that's 7 days a week. Work with your physician. You can call the Department of Health, you can call Noise Health, and people can get tested. So there is a myth out there that people can't get tested for some reason. They certainly can. It is available, and it is growing. How is it growing? The county and Noise are both partnering together to try to get more tests, swab kits procured. So we're working very hard. We have orders coming in at 50, at 250, at 500. We expect in the next couple of weeks to have a total of about 6,000 test kits that are coming into the Emergency Operations Center that we will then distribute back to Noise or keep ourselves for testing purposes. People are asking, what is the testing like? It is there's some discomfort and some pressure. Basically, it's an elongated Q-tip style swab that gets shoved up the nose. It's a nasal swab. It's not painful, but there is some discomfort and some pressure, and it takes about 10 seconds. Testing is very important. We hear a lot on the national and state front about what the purpose of testing, why, the talk about is there enough testing capacity out there? And New York State has ideals to grow the amount of people tested, double it on a per day basis. So we are appreciative of that. We hope that materializes. But do know that we are, ourselves here in Livingston County, are scratching and clawing every single day, 7 days a week, to try and get more kits here, because if you have the kits, you can distribute it with the health system and actually get more folks tested. So more folks tested means more identification earlier on, and then means eventual isolation, especially of the folks that are considered the asymptomatic carriers, so they don't have any known symptoms. They're walking around, but they are COVID-19 positive. I want to shift gears to the a little bit more on the cases in Livingston County. We are up to 54 positive cases in the county, of which 635, as I said, have been tested. So we're hovering a little bit lower than that 10% mark, which roughly is what it has been since we started testing. The folks, if we had 100 people test, about 10 people would come out as COVID-19 positive. We also have many, many recoveries, and people ask, what does that mean? Basically, you want more than 7 days of no symptoms and no fever for 3 days without the use of fever-reducing medications. So we want those two things to be happening to classify and note someone as being recovered from COVID-19. Also on the cases, we get some questions on the maps. There are federal maps. There's the Johns Hopkins tracking. There is the state has some State Department of Health mapping. I encourage you, although there are other maps out there, and some of them have different statistics that they're tracking and different methods that they're using, I encourage you to use the county map. Use the county website, livingstoncounty.us. If you go in the middle, you'll see the nasty looking red virus ball. That's COVID-19. Click on that, and that will take you to the website that has all the information that's available on COVID-19, including the map. And the map is updated every single day. So that's the most current. It's specific to Livingston County. It contains data that the county health department gets. They are the gatekeeper of the information, if you will, as it relates to positives, negatives, who's getting tested, when are the results coming in. So I encourage you to go to that. Where in our county are there cases by town? You will find that on our map. Additionally, on testing, we are working with our own Center for Nursing and Rehabilitation, which is a public nursing home, to get our CNR staff tested. That commenced today. The Avon Nursing Home commenced an effort to have their residents tested, and I'll get to nursing homes next. So I think you'll gradually see an expansion of who is going to get tested. I think you'll see a gradual opening up a little bit of through your physician's offices, through our own health connections in the community. You'll see a kind of a broadening of who can get tested as the test kits become more available and more folks ping positive who are asymptomatic. So you want to really get those people offline, in isolation, in quarantine, so then when they develop symptoms or even before and they actually have a chance to spread the virus to other people, they don't do that. So moving on, I'm going to talk about nursing homes. That's a hot topic of late. It's a topic near and dear to our hearts in Livingston County. We run a public nursing home. We run a fantastic facility in Mount Morris. We have great staff. We have great residents. We've been in the business for a long time. So we know about nursing homes. We know about nursing home regulations. And we know how difficult and challenging the business can be of being responsible for the care of hundreds of residents, the family members of our own residents, family members that live in the county, who are making us and having us be responsible for the care and for the safety, security, and health of their loved ones. We maintain a public nursing home in Mount Morris. It's 266 beds. There are two other nursing homes in Livingston County. One is in Livonia, which is the Canisius Lake Nursing Home that has 48 beds, and there's a 40-bed facility in Avon, and that's called the Avon Nursing Home. So there's 3 nursing homes. So what's the county doing in relation to nursing homes? Why is nursing home care an issue? Well, let's start with the second question. Nationally, it became an issue in the first instance of COVID-19 discovery. That was in the state of Washington. Numerous positive cases, sadly and tragically, numerous deaths at a nursing home facility in the state of Washington. You read now downstate in Brooklyn and the other boroughs in New Jersey. You hear about cases local and near, more closer to us. Monroe County has some cases inside nursing homes. Also some deaths. Steuben County in Hornell and in a couple of facilities. Again, same thing. A spread inside a facility. We have one in Livingston County at the Avon Nursing Home that has now, as of this morning, 8 cases related to that nursing home, in addition to a couple of deaths. That concerns us greatly. We have made outreach to the facility. The facility has had contact with the State Department of Health as late as yesterday, and they were going to be testing the residents, so that's a great step forward. That's what the county can do in those situations. We can be the conduit to try to help out and assist the nursing homes in the county, in addition to our own nursing home, acquire PPE. We can also be transparent and share with the public and to the public any information that we feel is in the public realm. And for us, that means we set up a data tracker on the county website that lists the 3 nursing homes and how many positive cases and how many deaths are in each of the nursing homes, including the county's nursing home. What about PPE? We hear a lot about PPE, personal protective equipment. That is something the county has worked vigorously on since the first COVID-19 case right out of here at the Emergency Operations Center. We spend all of our days for a select group of people only doing the procurement of this type of equipment. So we're trying to get our own stockpiles to help out private nursing homes, physician offices, first responders, because the state stockpiles that come to us, which they're greatly appreciated. We are very grateful for them to be supplying us that PPE. Sometimes a request is made for X and less comes in. Whatever the state can afford to provide us, they provide us. So we have to kind of make up that difference. So there is a lot of talk on PPE, what's available, what's not available. We have a surplus, we have a deficit, where is it? I will tell you that from our purposes in Livingston County, more PPE could be provided through the federal or state stockpiles to counties like Livingston County, who are trying to make whole as best we can any request that comes to us from the provider community. So if you do happen to speak with your federal representative or your state legislature or anybody else in the governor's office, you can tell them that additional PPE is of course appreciated and needed. It's essential and it's needed in counties like Livingston, where we are helping to procure the PPE and then redistribute back to the provider community. The other thing that it comes out about nursing homes is, again, back to the transparency, is what can you share? We are not sharing private information. We are not sharing confidential information. We are simply sharing public information that each individual nursing home, ours included, has to submit to the Department of Health. We have to note if we have a positive case. We have to notify family members if we have a positive case or a positive staffer. So we're already going to have to do that. So we figure that is public information. It's public information once it's received by the Department of Health. So we're getting out in front of it and informing the public of what the situation is. And that's basically the best we can do. We are not the regulatory body of the nursing homes. That is the New York State Department of Health. But we're working very closely with them and in concert with them on any form of assistance we can provide on this very, very critical issue. We probably get a half a dozen to 10 calls per day relative to the issue of nursing homes. The governor gets a whole slew of questions after his press conference when he gives his remarks about nursing homes. That is because they are a vulnerable population, medically fragile, and they're in these environments where the spread can spread very quickly if it's not contained and controlled. And even the best nursing homes with the best infection control practices can have cases where this thing spreads, because this virus, as Dr. Fauci talks about all the time, is extremely efficient and effective at its spread. So that is the case, the update on nursing homes. One last thing. Just a correction, it's sort of a pet peeve of mine. Governor's doing a very good job informing and updating the public in his presentations. Just one plug here for anybody that's watching that's affiliated with the governor or the state government. Regularly there's questions about nursing homes. The answer invariably contains a message that nursing homes are private sector enterprises. They all are not private sector enterprises. There's about 20 public nursing homes. We're very proud to run one. We're very proud of our public nursing home, our public nursing home staff, the administration of our county nursing home. That is a county government function. We're very proud to operate it. We're very proud to run it. And we hope that the messaging gets cleared up that it's not all private nursing homes. Counties run public nursing homes. I want to shift gears. If you're just joining us, my name is Coyle. I'm the county administrator in Livingston County, and we're doing a COVID. I have a crash test dummy in the emergency medical services office over here. I wasn't gonna. There's no we. It's just me. Sean here is very helpful for me as the cameraman behind the scenes. But all you've got today is me. So I apologize if you were expecting somebody else to join me today. I'm going to shift gears to New York State pause and guidance from New York State. So we're on this pause. Pause stands, P-A-U-S-E stands for something, but basically it's stopping, essentially pressing pause on the economy, on operations, on certain state government functions, on certain county government functions, in relation to what we're all facing with the COVID-19 crisis. So New York State is on pause. That pause has been extended. Primary issues associated with that you hear a lot about. Of course, the mask and any guidance on masks. So right now, everyone is encouraged and basically mandated to be wearing a mask if they cannot maintain proper social distance. So again, if you're out and about, grocery store runs, if you go into a grocery store, you should be wearing a mask. If you go for a walk in a public park by yourself, okay, maybe not. If you go for an early morning stroll in the neighborhood, no one's around you, maybe not. Any and all other occasions, you should be wearing a mask. So that's a New York State guidance document, a directive, an executive order. You then have this gathering that is gathered, bad pun, that's gathered a lot of steam in terms of controversy. There's no gatherings of any size whatsoever. That still is part of the mix. That still will be enforced. We get lots of questions on when is this thing going to end? How long can we go on for? Let me tell you what the guidance is. Let me tell you sort of the personal opinion. So the guidance is, just as we closed gradually, we'll be opening up gradually. So that the valve of the economy, if you will be gradually on a percentage basis opened up. So what essential businesses can be sort of greatly more expanded as far as their operations than they are right now when they were reduced? Can we bring people back that were working remotely, for example? Can we classify other businesses as essential gradually, incrementally, that are not right now on April 23rd classified as essential? That can be done. Always, though, maintaining some form of emphasis on social distancing and the mask wearing. Both of those two efforts really flattened the curve in the region, upstate New York, and actually in New York as a whole. Even though New York got creamed, and it's sad and it's tragic, and the death count is a sad statistic that we all have to view on a daily basis in the governor's press reports. Despite all of that, we have done a great job as a community, and Livingston County residents especially, in doing their part to try to flatten the curve by following these directives and orders. I know it's painful. I know it stinks to have to be inside and to not socialize and not gather and not be with friends and family for now this is an extended period of time. I understand that. I empathize with you. I feel it too. But it is working, and it's for the betterment and the best elements of public health that we need to do that. The Finger Lakes region will open up as a region. So the latest plan has been the regions of the states, New York, Connecticut, Massachusetts, Pennsylvania, New Jersey, all together working in concert with their rules and regulations. The state takes that to the granular level and also is talking about regions opening up kind of together. Our region would be the Finger Lakes region. Bob Duffy, former lieutenant governor, former mayor Rochester, presently the president of the Chamber of Commerce in Rochester, is going to be the lead overseeing that. So that will be sort of the next step. We don't know when exactly that will commence, but I would expect shortly after the 15th of March to have some graduated incremental advancements on the opening up of this economy, this region. I will say one last thing on the New York State pause and guidance. We get a lot of questions. We are caught in the middle. We're not passing the buck. If anybody knows me, I'm not someone that's going to pass the buck. But in this case, we do struggle, and it is a challenge with respect to the guidance and the directives that come out of Albany, and the enforcement, the clarity, the definition, the help or assistance with respect to the guidance. We are kind of caught in that middle. We want to be the educator to the public. We want to be the person that informs and helps out and assists, but stuff does happen to change. I mean, the golf courses went from open to close to open to close to open. Marinas, boat launches. The latest and greatest is campgrounds. We hear a lot on campgrounds. Livingston County took matters into our hands based on what the state guidance was and closed campgrounds. It's been very controversial. We admit that. It's been very challenging. We admit that. But that is the guidance that we're working under. If the state is more definitive and clear and unambiguous in future directives on campgrounds, we will then take appropriate responsive action to that. But until such time, it's what we have to deal with, so please bear with us. I want to shift gears into some federal actions next. So the federal government, unlike Livingston County, can print money. So the federal government is infusing a lot of money into the economy, into small business, into unemployment. into hospitals, into eventually, we're not going to wood, state government and local government. When I say that, I primarily mean county governments. So the first advance checks have come or are coming in from the SBA, which is a small business assistance, the federal government arm that's charged with the distribution of the PPP Paycheck Protection Program, that made a lot of news because it was pushed out. It was people participated in it, and all of a sudden it dried up with their available cash allotment after only a couple of days. So the latest and greatest federal government stimulus package has infused many more billions of dollars back into that program to try to get money to small business. That's the precursor to a form of long-term financing. Companies are expected to be working with local banks, community banks, the Small Business Association, the Chamber of Commerce, the Small Business Development Center out of SUNY Geneseo is still operating and working. Our own Economic Development Office, as I said, we are here to assist you in any assistance that you need. The federal government also did a $600 kicker to the unemployment insurance claims. In Livingston County, just in the last 4 weeks, we've got 3,500 filers for unemployment. That's a sobering, sad statistic. The unemployment rate could be the highest that we've seen in ages. This economic impact period is, on paper right now, greater than anything we've seen, including the Great Recession since the Great Depression. So that is going to be felt locally. It is already being felt locally with layoffs, business, temporary closures, furloughs, things of that nature. We do anticipate an additional package looming. If you follow our social media feed and our press releases, we've been very vocal in our support about this measure. The Senate Majority Leader Chuck Schumer, Minority Leader Chuck Schumer, the senior senator from New York, has been very vocal and supportive of county governments getting an infusion of direct and flexible dollars. We are on the front lines of the crisis. We have an economic impact in our revenue loss. We have an economic impact in our expense outlay for this, the containment of this virus. So we're very much front lines, bad pun. We're on the front lines of asking for any stimulus funds that are going to come in the next package to come to counties, if at all possible. New York State, I agree, does not need a bailout for pre-COVID budgetary problems. The state, before COVID was starting, had budgetary issues as a state government. I don't think the state government is asking for assistance relative to that. They're asking for assistance relative to they are the epicenter of the crisis from a case count perspective. They have spent billions already in the fight, and they will have billions in